Okay, in this video, we're going to go over ED LaunchPoint for the ED providers. When you first log into FirstNet, you are going to see LaunchPoint. If you want to check in, you can click the hamburger menu up here on the top right. You can go to check-in. It's going to open your usual provider check-in screen. Nothing here has changed. Always just make sure that you've got your provider role and your default relationship entered correctly. And then you can hit OK, and it'll check you in. You can also check in by coming to the assignment column, clicking on your patient's row, and then you would be able to check in if you had not already. If you want to assign your patient, this part hasn't changed either. You can just click assign, and then it's going to sign you up for your patient. If you need to change your location, you can come to the hamburger menu and click change location, and then select your appropriate emergency department, and it will change your view for you. So it is going to load U of L's launch point for me. I'm going to go back to Jewish. One thing that you're going to want to do when you first log in is change your zoom. It will default to 100%. You can change it to 95. That'll get you an extra 1 or 2 rows of patients on the screen. Next part here, these are called your ED LaunchPoint zones. You'll have My Patients, so if you've signed up for patients, you can click on that one and it'll just show your patients. If you come to the All Beds, it's going to display all your beds and all the patients. Triage will just display patients that have the triage event that has not been completed. If you're working at Jewish Downtown, you're going to have one for hand care that will only display the patients who have had the hand care event triggered on them. And then the admitted zone is just going to show patients who have the admit order placed on them. Let's go back to the All Beds. One thing you're going to want to do when you log in for the first time is make sure that you click on the waiting room and put so that it has a box around it. That way you'll be able to see those patients that are in the waiting room that need to be triaged. The other thing you can do is if you like to see empty beds, you can click on empty beds and then you'll be able to see all the beds in the emergency department. If you don't like to see that one, you can just unclick it and then you're only going to see the beds that actually have patients in them and the patients that are in the waiting room. If while you're on the All Beds, you want to filter to see your patients, you can click My Patients. This next one right here, you can hit the drop-down arrow and you could say, you can use the different options to do either My Role Unassigned or My Role Unassigned and Physician Unassigned. And then it's going to filter to show your patients at the top and then all of the Physician Unassigned patients as well. Over here in the room column, one thing that you may also want to do is to hit the drop down of the sort column and click on sort by bed sequence. That way it's going to organize the board based on the patient's room. Also in the room column, you'll see the patient's room number. If the patient has certain types of alerts, you're going to see that displayed below the room number. So this patient in bed 2 has a security hold. You're going to have high alerts, which will turn the room red. So that's your ventilated and your ICU patients. Other alerts will turn it orange, so like security hold, sepsis alert, police custody, no visitor, will turn it this orangey yellow color. Also on room 2, you can tell they have the top corner folded down. That means they have too many alerts to display. So if you hover in the room column for that patient, you're going to be able to see all their alerts. So they have the security alert as a high alert, and then non-critical alerts were that they were a hand care patient. If we look at bed 12, you can tell that they have striping on the side of their room column, and that means this patient either has isolation or a positive travel screen. Once again, if you hover, it's going to tell you that exactly what triggered it, and for this one, it was that they had a positive travel screen. We have just regular alerts as well. Disaster is one of those, and they do not change the room color. You will just see the words listed below the room number. All right. Moving on to the status column. When your patient first arrives, they'll be in the status of triage needed. Once nursing has completed triage, you'll say triage complete. Um, and then until a provider has signed up for them, it will say unassigned. And then once the provider signs up for the patient, it'll stay in this eval in progress status until all the orders are complete. Then it would change green, and you'll get the white check mark to show that all of your orders are complete. Um, Also, once you start to enter disposition orders, then it's also going to change the status column. So if your patient's being discharged, it'll change it to blue with the door. Transfers will just be gray. Admits, you're going to see them with the little bed. You'll also have a room timer or a timer from when the order was entered right here. You'll see what level of care they're targeted for. Once they have a clean bed ready, the unit coordinator will make the update on the board. You'll see the bed with the check mark above it, and then they can also enter the room number right here as well. Anytime you see the key means that registration still needs to see that patient as well. Your timers will update as new orders are entered or as a new status has happened. So when you flip them to clean bed ready, it would start back over at 0. Coming over to the patient information section, you're going to see your patient's name. You'll also see their age and their sex. If you click the patient's name, it will open their chart. It's a blue hyperlink. Anytime you see anything that's a blue hyperlink, it's going to take you somewhere else. It'll either open a chart or open a certain section of the chart. The other thing you'll see in the patient information column are the icons. We do not have as many on LaunchPoint. You will see certain ones. Anytime you see the blue side of the head, that's going to be some type of behavioral health issue going on. So they could be a security hold. They could have, they could be a dangerous patient. They could also be suicide risk. If your patient needs an interpreter, you'll see this little eye with the blue background appear. You also have your traditional allergy symbols as well. You're going to see a few new ones as well. This 24, 48, or 72-hour return, when you see that, that means that your patient has been to one of the U of L health emergency departments in that time frame. So you may want to look into the chart a little bit more to figure out why they were recently seen. You also will see one for when the MPO order is entered. On this patient in bed 12, you can see that there is an arrow right here. That means there are too many icons to display. So if I hover on their line, you're going to see that I also get the biohazard sign for isolation, their allergies, and then that 24-hour icon. When you're in the patient information section, if you left click in the blank space below the patient's name, it's going to open up your patient summary screen. This is a really great screen with a lot of handy information. Once they've been triaged, you will see what was documented by triage up here. You'll see their vital signs, home meds, medical history, social history. If your patient has been to the emergency department previously, you're going to see previous emergency department provider notes right here. If they had been admitted to the hospital, you're also going to see like their H&Ps and discharge summaries right here as well. If your patient arrived via EMS and it has been scanned in, you'll see your EMS run sheet appear under important notes. Let me switch locations and show you a patient that has some previous documentation. So this patient's been to the emergency department previously. They've got a burn admission H&P. You could click it. It's going to open up that H&P note for me to read right here from the LaunchPoint screen. So I didn't have to go digging through the chart. Next is your acuity column. And then we have the patient details. When the patient first arrives, what's going to display here will be the reason for visit, the registration enters. Once they are triaged, it's going to be what nursing puts in as their chief complaint. So like on bed 12, nursing typed in chest pain times 2 hours. And then once a provider has entered a diagnosis, it will update to display that diagnosis, and you'll see a DX in front of it. Um, if you click what brought the patient into the emergency department, it's going to open up this diagnosis and problems in page where you could add health problems or enter your diagnosis. You can still do that from your note, but this is a different option if you want to do that. Below that, you'll see this little blurb, and if you click it, it's going to open up your provider column and your nurse column so you can enter whatever information you need to communicate to the nursing staff. Over on the side, you'll also be able to click and then have the preset information. So you can click floor report ready, save it, and it's going to update that on the board for you. Anytime you're on the patient's row, you can always right-click, and that's going to open up what we call the patient context menu. At the top right here, it's going to quickly drop you into the certain place on the chart. So if I take quick orders, it's going to open the chart and take me right to my quick orders screen so that I can start placing orders. The next section is going to open up certain power forms. So if you need to do that documentation, it's going to open the power form up for you to do that. You've got quick disposition orders right here. So your ED transfer order, if I click that, it's going to open up the add order screen for me with that ED transfer order. And then I am able to enter my required fields and click sign, and that order will be placed for me. If you needed to set events, you have the ability to do so from the right-click menu as well. Another way to assign or unassign providers. And if you want to see your patient summary report, you can just click patient summary report and it will open for you. We already talked about the provider assignment column. This is where you'll see what ED providers have signed up and what nurse has signed up for the patient. The next column is the physician notification column. In this column, you're going to see like orders that need to be co-signed that nursing has entered. You'll also see certain power forms populate here. So if your patient is in violent restraints or nonviolent restraints and the face-to-face eval needs to be completed, you could click this, click document, and it'll open up that power form for you to document. You would complete the yellow fields, and then you could say save, and it would fall off of your list for you. As you get lab and radiology results, you will also get notification in the provider column that you have labs to review. You can click review, and it'll open up the lab section for you. All things Cerner, the default is the reverse chronological will display on the left, and then to go back in time, you scroll to the right. Next, you have your document management column. When the patient first arrives, you'll have a white piece of paper. If you click that, it's going to open up your note screen, so where you can pick your appropriate notes and then go right into your documentation. Once you have started documentation and you save, you're going to see this little icon, the white piece of paper with the writing on it. And then once you have completed your note, you'll see the green piece of paper with a white check mark. If you have multiple notes, you can hover to see who did what note and the status of it as well. The next section is the order section. The pill is for medications, and then your lab orders will be the test tubes. If you need to do EKGs, that's with the little heart rhythm. Your radiology is the next, or imaging is the next symbol, and then patient care is the little suitcase. And then if you need to place consult orders, you can come to the telephone. And if you just click on under that, whatever you need to place, it'll open up that type of order for you. You have your LaunchPoint quick orders over here where you can quickly place those specific orders if need be. If you need to go to quick orders, it's available right there for you, and it will take you to the quick order screen to place orders. So if you wanted to order acetaminophen, we can click it. It's going to put it in your drawer at the top up here. If I needed to switch over to a different type of order and place some quick orders as well, I can easily do that. And then once I've ordered everything that I need from LaunchPoint quick orders, I can do orders for signature, sign, and it's going to place those orders for me. You'll get a green dot beside the categories that you have placed orders for. You can close that, and then I will see the icons light up for the orders that I did place. And if I hover, then I can see what order have been placed, by who, and the status of them as well. Below the little icons, you will see the status bar, and they will start to fill from left to right as orders are complete. For your lab and radiology, once it turns green, that means that you have results and all the orders have been completed. Um, you'll also get a little square around the icon as well to know that you have results. Anytime it turns red, like this one is for lab, it means you have a critical result. For radiology, when you get a report back, you'll see this extra little paper symbol over top the radiology icon. If I click that, I can see that I have the CT ahead without as a hyperlink that's available for me to click. When I do that, it's going to open up that CT head report from radiology for me as well. Once all orders are complete in a category and have been reviewed if necessary, then the icons will dither or gray out, like this pill icon here, or the telephone icon. To stay column, it's going to display face up the bedded length of stay, so the time that the patient was actually placed in a bed. If you hover, you can also see their total length of stay, the time that they arrived. Next, we have the vital signs column. If you click the little arrow right here, you can expand that column so that you can see all the vital signs and your Glasgow Coma and Muse score if they've been documented. On LaunchPoint, anytime you see something glowing red, it means it's either overdue or a critical value. So like all of these statuses are glowing red because that means the orders are overdue. Our length of stay is past our set threshold, so it is glowing red as well. Anytime you see the red outline around the heart, that means that your vital signs are overdue. With the vital signs open, you can also see anything that's glowing orange or red means that you have critical values, and if it's blue, it is below the normal. You can also see your statistics up here at the top for your patients and then the department. You have this checkout zone over here. If you click that, you can look at patients who have been either discharged, admitted, or transferred. You can quickly go between 12, 24, 48, or 72 hours. If you need to set a custom time range, you can do that as well. You can look at a maximum of 7 days at a time. Or you can just also go back and pick one day if you know a patient was present on one day. Yeah. You can filter to just look at your patients. You can also filter to look at your unsigned notes. And you can also filter to look at certain dispositions if needed. Um, over here, if you want to look at your documents, you want to look in the My Documents column, and then you will see the status of your note just like on the other launch point. So either the green piece of paper with the white check mark if your documentation has been completed, it'll be just the plain white piece if documentation hasn't been started, and then it'll be the white piece of paper with the writing on it if it's in progress. Um, the second column lets you see other documents by other providers.